So it is my honor and privilege to introduce to you the co-program directors of the MSc in Precision Health and Medicine program, administered by the NUS Yonglulin School of Medicine. So first, we have our Associate Professor Caroline Lee, the Vice Dean of Outreach and Admissions at NUS Graduate School. Next, we have Dr. Kenneth Ban, Senior Lecturer in the Department of Biochemistry and leader of the Health Informatics track in NUS Medicine. And last but certainly not least, we have Dr. Lim Lee Jin, esteemed instructor in the Department of Biochemistry and of course, co-director for the MSc in Precision Health and Medicine program. Thank you, speakers, for affording your time this afternoon. In the next 40 minutes or so, we will hear from all three of them and discover how the integration of precision medicine and the digital care economy is shaping the future of healthcare. And along with it, what are some of the challenges and opportunities that are faced in this sector. Once again, there will be a dedicated Q&A segment after the session. So to our virtual audience, you should be very familiar now. Feel free to type in your questions in the chat box next to your video. And for those of you who are here in attendance with us physically, you can simply scan the QR code that you see on screen or approach the mic in the middle of the room later to pose any questions that you may have. So without further ado, please allow me to invite Dr. Kenneth Ban, the first speaker of today, to commence the session officially. Dr. Ban, please.
All right. Thanks, everybody, and thanks to organizers for inviting us to share about, firstly, where we think the care economy in terms of healthcare is going. And we'll also talk a little bit about our new master's program about precision health and medicine. We have some questions along the way so that anybody in the audience here, as well as those that are joining us from hybrid, you can go to this website, which is polev.com/precision. So we have some questions along the way. Hopefully we'll make this interactive. But feel free later, you scan the QR code, please submit your questions along the way. All right, so again, I'm Kenneth, and I'm joined by Prof. Lee here, who will speak next. And then lastly, Dr. Lim Lee Jin will share a bit more details about how our school wants to approach this problem of actually upskilling our future students to prepare for the new healthcare economy. All right, so I'm going to talk about some challenges, opportunities for the future, what we think is a data-driven healthcare economy. I'm going to touch a little bit about how data actually is not a new concept, all right? Healthcare is always driven by data. But what's different is actually now we have a whole slew of new technologies now that have increased the throughput of how we can get data from patients. You know, not just from patients, but in the healthcare setting, but also in our research labs. All right, so let's try this one out. Let's see whether technology serves us or not, or becomes a hindrance. So again, you can join us in polev.com/precision. And hopefully you'll see on the website if it works. You can point your finger and just see, okay, all right, cool. So I suspect if the thing is working, all of you who are responding in this thing should locate yourselves in Singapore, all right? So if you're in this room and point somewhere else, come talk to us in case you're lost, all right? So you can see, all right, cool, depending on where your finger is pointing at, all right, good, generally in the region here. All right, so this is just an icebreaker just to roughly know where you guys are. And those of you who are joining us on a hybrid session, please join us also. All right, okay, so this one I'm not familiar with, all right, somewhere in the middle of the ocean, all right. I attribute this to some inaccuracy with the touch point mechanism. Okay, so some icebreaker questions. Just wondering, what's your current field of study? All right. Generally, we don't want to make the presupposition is that because you have involved in healthcare like that, you want to know about healthcare. I think in the new economy now, a lot of people actually are looking at mid-career switchers, things that they have been trained in undergrad. They may want to, explore something else. So let's have a look at it. Okay, wow, okay, cool. So, nearly half of you are responding here are trained in the hard sciences, for example, computer science, data science, and engineering. So that's cool because actually we are seeing that in precision medicine is going to be a confluence of the general the typical kind of data that we are seeing from healthcare, but we also need more people from computer science and data science to bring this to fruition. Some of you from humanities, social sciences, great, fantastic, all right? Okay, all right. Okay, so some of you, just as a gauge, may have heard about this. Some of you may have heard, at least in Singapore, there was some press release about the Singapore's National Precision Medicine Initiative. So I just want to get a sense of that. All right, cool. So you know a little bit about it. That's good. Some of you have not heard about it. So if you have not heard about it, hopefully we will give you a general sense of where things are heading. All right? Okay, fantastic. Okay, none of you consider yourself an expert. All right? If you do, please identify yourself, all right? We may recruit you also for our master's course. Okay, fantastic. All right, so I'll just take you a little bit back in history just to chart the journey. Especially, I noticed that maybe close to half of you maybe have a strong background in computer science, data science, may not be directly in the healthcare field. But I just want to chart the journey of where we are heading. So this is, the type of picture of what we imagine a doctor would be. This was in the late 19th century. It's very personal. Okay, the doctor actually will visit you, and this is a poor sick child here, and doctor will try and gather as much data as possible using his senses to try and offer a diagnosis and hopefully offer some relief. So there's limited data. Okay, it's limited by the senses here. And there's a less formal structure of patient records, all right? So if you look at this website here from Cambridge, it actually digitized some of the old patient records. You can see the penmanship is actually amazing, all right? How many of you have seen doctor's handwriting? Okay, all right, so we have evolved a bit. This one is impeccable penmanship, although it's in Old English, so I don't understand what it means. All right, so this is closer to what we understand by healthcare, all right? Some of you may be unfortunate, to actually visit a hospital or something like that. You see like beds like that. It's a more structured format. And even like in the 1980s or 90s like this, it's all mostly paper-based. All right, but this is not the world that we live in now. Now it's more complex. And healthcare is evolving, and you've heard about things like Healthcare SG. So it requires the whole community to actually deliver healthcare, hopefully better, all right? It's more complex, but hopefully better. So it's not just people that we traditionally see in the hospital. What we are hoping for is that people are actually taking care of their health in the community. And those that require some regular care will see the doctor or the healthcare professional in the outpatient setting. Now, unfortunately, some of them cannot be handled either in a community or outpatient clinic, would actually end up in inpatient wards. Now, you can see where, with advancing technology, we have data from so many sources. You go down there, you have actually people sticking needles into you to gather some blood. It could be a urine sample or any other sample from the body. So there's laboratory tests, imaging, x-rays that we are familiar with. And there's some tissue samples that actually go through microscopy to have a look at the general structure of cells. There's also data coming from what types of medicines are prescribed or what types of interventions such as procedures that are done for you. So the bottom line is that the patient journey is actually more complex. There's a wider array of diagnostic tools, and some of these you're familiar with, even if you just visit a local doctor like this. And how many of you have visited a hospital or doctor's clinic where the doctor is not writing in pen and pencil? There's often a computer down there, and while the doctor is asking questions, you see a doctor furiously typing away, all right? So that's how we are digitalizing healthcare data. Now, how is it evolved? Where does this thing called precision medicine heading? So it turns out that we can go to very fine molecular details. So you heard about DNA that actually contains all instructions for, the instructions for the whole human body. It gets transcribed to RNA, it makes proteins, and then it acts on chemicals like that. Now, regardless of where we are on this molecular profile, we have different technologies now at different stages of maturity that you can actually get a lot of data. All right, it could be from any sample from the body. And that's where the challenge is. That's why the confluence of computer science, data science actually is driving the advances for precision medicine. So we are already confused when we're Excel spreadsheet of data. How many of you look at Excel spreadsheet of data and I can't make sense of it, all right? You have to do some bar charts and things like that. So imagine the Excel table is actually, the number of columns is like 10, 20, 30,000, and the rows will be like number of patients that you see. We cannot comprehend that, so we need algorithms to actually find patterns, find predictors. That's why AI and machine learning are becoming more in the forefront for healthcare. Now, from the research standpoint, we want to understand insights so we can understand its function, maybe develop new treatments. But we do not need to require that long kind of incubation period, all right? Some of these actually we can develop predictors and you can actually try to find some more accurate ways of diagnosing or prescribing treatments or even better still, to identify people who you can say that, maybe your diet may be changed so that we can prevent some onset of disease, all right? So these are the exciting things that are happening. Now, just to illustrate how far we've progressed, all right? So this one was in, I think, 2000s or so. Traditional sequencing for just one human genome, it was a massive effort over 10 years and costing nearly $3 billion US. Of course, correcting for inflation, this is much larger sum now. And can you imagine that this is not viable, okay? Nobody's going to spend $3 billion for one single patient. Now, you fast forward then, this one is like already 5-6 years late already. You have machines down there, and some of you are interested, you can actually visit some of these companies within Singapore who are actually doing this. You can get it down to less than $1,000 US per genome, and now it's even decreasing. And there are actually companies, this started as a spin-off from Oxford University, where you can actually have sequencing devices as like a USB device. So you can see that this is tremendous progress, and this has been actually accelerating uptake of these technologies because the cost has come down. So we think that we're at an inflection point now. You may not see it at the clinic, but we believe that, at least in the next 5-10 years like that, this is going to be the future. And you know that training takes a long time, so what better time to get started in this field? Now, where are we as a nation here? Okay, so for those of you joining from overseas like that, maybe I just give you a landscape of where Singapore is heading. So this is identified as a national priority, as with many other countries in the world. There's the US effort, there's the UK effort also, and also efforts in the Asian region, including China and Japan. So this is Singapore's Precision Medicine Roadmap, and you may have seen the press release about this, where we successfully completed phase 1. So they sequenced 10,000 Singaporeans, and the data is coming up looking at a profile of certain predisposition to disease in our population. Now we're in the second phase here, where the national body, which is coordinating all the different ministries, whole of government effort, where we're going to scale up to 100,000 Singaporeans, and hopefully the information here will help to guide things such as identifying patients that may be susceptible to disease, so we can actually target and say, okay, this group needs closer monitoring, so we prevent progression disease. Or those of already have diseases already, maybe we can identify them more accurately earlier, so we can prevent them from progressing so far ahead that the treatment is so expensive. And of course, the last part is like, if you ever have the disease, there are multitude of treatments down there. Perhaps some of this data, together with advancement in data science, AI, and machine learning, we can identify really specific treatments that we don't waste, patients' time and money. Okay, so you can see that roadmap is actually quite far ahead. Hopefully, by the time 2027 like that, we establish the whole population scale genomics, and there will be a kind of daily use of precision medicine. All right, so do we see that this is the future for what Singapore government is heading to? So, rather than me trying to paraphrase something, Let's hear from Professor Kenneth Mark, who is the Director General for Health in the Ministry of Health. So he also says that it allows us to apply more targeted interventions rather than providing a whole basket of treatments, okay? So you assume that every one of us is roughly about the same on average. So we give like a general kind of class of treatments. But the hope is that with this additional data, comes from all these advancing technologies that we can do molecular profiling, that somehow we can find something that works for patient medication treatment. So we'll give them the greatest benefit while trying to minimize the risk. So that's the dream, of precision medicine. And this is later, Prof. Lee and Dr. Lee Jin will describe more about how we think we can educate the workforce for this future. All right, so maybe just a break here before I hand over, asking, well, I didn't say that what are your reasons for learning precision medicine, okay? The thing is a conditional, all right? I make no assumption. If you are interested in learning about precision medicine, what are your possible reasons? So some of us want to learn and to switch field because of very personal reasons. Sometimes it's just mere curiosity. In fact, that's what we want our education system. We want our students to be more curiosity-driven, all right? Okay, cool. All right, of course, the hard thing is that, is there a career for me, right? So I won't elaborate on that. I will hand off over to Prof. Lee as well as Dr. Lim Lee Jin. All right, cool, can see career opportunities. Wow, I'm very heartened that curiosity is one part of it. Okay, great. I won't go this one, and then I'll hand over to Prof. Lee now.
Thank you, Kenneth, for sharing about the rapidly evolving field landscape of healthcare. So now I'm just going to give you a little bit sharing about how you can prepare for the future data-driven healthcare economy. As you can see, one of the greatest thing about this evolving landscape is change. Okay, change is the only constant, and as the wise Benjamin Franklin say, is how we adapt to change that will allow us to be successful in life. Okay, so because things are changing very fast, and what is the greatest change right now that we have experienced very recently? Anyone? The greatest disruptive change in the whole world that all of us have experienced and came out of, and that is COVID-19, right? COVID-19 is, the COVID pandemic is one of the biggest major disruptive change that has transformed the world. This momentous event not only tested our resilience, but also revealed some hidden potential within us to adapt, to innovate, as well as to unite together. So what are the, when you look at COVID-19, there is both bad and good in COVID-19. For example, it has both disruptive as well as transformative change. For the bad, many lives were lost, and many of our economy was disrupted. And most importantly, our human interactions were disrupted quite a bit. And there was this big pandemic of fear that was caused by distortions, rumors, hysteria, fueled by untruths and xenophobia. However, amongst this, there are some good that came out of COVID-19. One is we can experience the humanity, the great humanity where people were helping people. But I think in this talk, I would like to focus on the last part of it, where out of these bad things, there is this breakneck development of technological innovations and pushing us to a different frontier at the moment. And what are these technological innovations that facilitate this paradigm shift? There were some non-medical ones. For example, the rapid development of software for contact tracing to make sure that we can control the virus spread. And I'm sure you have heard about the infrastructural marvels that in China where they can build hospitals within days instead of years that it usually take. And there were robots for non-contact food delivery as well as next generation disinfections. On the medical side, there was also many marvels that came. One of it is advanced algorithms to better predict and diagnose the disease outbreak and spread. And what is even more marvelous in the medical side out of COVID, where record was break, where you can develop vaccines within a year. Do you know how long it takes for vaccines to be developed normally? More than 10 to 15 years. So for it to be reduced to a year, that is marvelous. And that was because of all these technological advances that I'm going to show you. And finally, there is repurposing of drugs for therapy. Okay? So what are these disruptive technologies that have potential to change the healthcare? And these includes the combination of, as what Kenneth has talked to you about, the next generation high throughput strategies. Sequencing, even proteomics is moving, although slightly slower than genomics, together with artificial intelligence. If we combine these two powerful things, we will be able to better predict disease, risk, infection, prognosis, or treatment response. We can even use this to design and redesign drugs to suit the individual patient, in a sense, okay? Or treatment thing. And there is, I'm sure you are very aware that all of us are wearing these wearables that can measure our heartbeat and all this. Hopefully in the near future, we can monitor our health, disease progression, or even treatment response. That is what the future is going to be. And I'm sure most of you will know about virtual reality, not just for gaming. It has been used to train doctors in surgery as well as assist doctors in robotics during surgical procedures. And some of you may have heard about nanotechnology. Nanotechnology has been used for us to for precise drug delivery, as well as serves as tiny or miniature surgeons. Then we have next generation robots with intelligence that can serve as intelligent exoskeletons or assist surgery, even assisting patients. And finally, I'm sure many of you have heard about 3D printing. Now we are able to print biotissues, example blood vessels and limbs, and even print drugs. So you can see that there are many, many disruptive technologies. Are we left behind, or are we going to go with it? So there is a lot of, within this sea of change, how do we then respond to change? One book that actually strikes me was this book called Who Moved My Cheese? It's a very, very interesting book about 4 different characters: Ham, Haw, Sniff, and Scullery. And these 4 characters are tells us a little bit about ourselves. In Ham, he is always thinking about the past glory, reluctant to let go of the past, and he will say, "Oh, it's not fair when something changes." Whereas Haw will hesitate to take the first step, but once he has taken the first step to find a new cheese, he gets to enjoy it. But I think we can learn from our little animals here. Sniff is able to perceive changes even before the change has occurred. Are we able to do that and then plan to move forward? And finally, we have Scullery, who is always responding to change immediately, so he immediately jumps into action. This could be more active, whereas this could slow down a little bit and strategize. Okay, so in this story, I've learned a few things. How do we respond to change? Because the world has changed. COVID has changed the world. COVID has changed a lot of how we do things. Do we just complain that the change is bad, or do we now help to improve ourselves for the change? Okay, so in this book, there are 5 steps that I've learned. The first is acknowledge change. Acknowledge that the cheese is no longer there. The cheese has moved. Then you need to anticipate change. You need to prepare for cheese to move, because the cheese cannot be there all the time. After you eat, it cannot still remains, right? And monitor the change. Smell the cheese often to see when it becomes old. Then you need to start moving to the next thing and change and move with the cheese. And finally, enjoy the change and savor the adventure. Open yourself up to new experiences. Because later we're going to show you that many of you may be in one field. Are you ready to bounce out to learn something else so that now you can move up with the times, okay? So enjoy the taste of new cheese. So to summarize, in order to respond to change, we need to move ourselves from a fixed mindset to a growth, change and growth mindset. What does that mean? That means that, first of all, in the educational mindset, the first thing you need to do is you need to strengthen your broad-based foundation, okay? Then you need to find something that you are passionate about and deep dive into this passion. But as you deep dive into this passion, remain flexible and be open to other possibilities and experience other things. And once you do that, again, continuously learn, and now you strengthen the second broad base and so on and so forth. And I think that is how we can move from a fixed mindset to a growth or change mindset. Okay, so I guess all of you are here because you are at some crossroads in your life, right? That you are wondering whether should you continue to work and study at the same time, or should you take a break? Maybe for those who work, because money is very important to you, you have to continue working. Here, money may not be an issue, so you need to reevaluate your life, re-strategize to see which path you want to take. And I think many of you come here also because there is, you want to improve yourself. How do I improve myself? So that you can have better prospect, better future, earnings. But importantly, sometimes you just want to change career because now you feel that certain things you are not satisfied with. And sometimes you would like to go into the current, go deeper in the current field, or to learn new field. That means become multidisciplinary. An example that Kenneth have explained, you are a data scientist, but you feel that you want to contribute to the healthcare thing, and now you need to learn a little bit more about genomics and so forth, so that you will be able to apply your data into genomics. Vice versa. You may be a life scientist, but now you really feel that the world is moving into data. What we have are all big data. I cannot even handle it with just looking at one thing at a time. So I need to learn that field. Okay, so be flexible. So this is where you want to study. So maybe right now I just want to pause again and ask what educational paths aligns with your aspirations and future goal. Are you looking for a certificate course, a diploma, a bachelor's, a master's, a PhD, or none of the above? Okay, there were quite a few, but majority of you are very interested in master's course. Okay, so I will kind of explain a little bit about the differences between these different courses. Okay, so I think most of you all have filled in, okay? Okay, so what are the different educational paths that you can explore? Many times you're talking about this, but there are certificate courses. So why would someone want to do a certificate course? Because it's much shorter and it focuses on a specific skills. For example, I'm only interested to learn R programming. So that is a specific skill that I want to learn. Maybe I'll just take a certificate course. And many a times for certificate course, you have flexible schedules. So the aim is to enhance your skill and knowledge. Sometimes you want to move to a new field. For example, you're a biological scientist, but because you want to get into this big data, you cannot just jump into big data. You need to take some intermediate courses, right? So intermediate certificate courses like R, so that you need R programming before you can do some of these things. Okay, so either you explore new course or new industry, but the disadvantage is it is limited in depth and it's not really recognized very much in the workplace. Then we have diploma. So diploma can be after your bachelor's or before your bachelor's. I'm sure most of you know Polytechnic is diploma too, but sometimes there are diplomas after the graduation. In diploma, it's more comprehensive than certs. It gives you a broader foundation of knowledge and skills, again, more entry level. It's a stepping stone towards further education. It holds a little bit less weight than masters. And then we have the masters. What is the purpose of masters? In the master's program, what you aim for is to advance your subject knowledge. So you want to go deep. Like I want to go deep into precision medicine, but precision medicine is actually a broad course too. But this is specialized training in this field, and you are actually training for competence. And your main aim is, I want to be better employed, okay? Employability. So this is one of the main focus of masters. So at the end of masters, usually you'll be awarded for completion of this study, and you have mastery of the field of professional practice, right? Finally, what is PhD, okay? Okay, in PhD, usually employment is not the first thing that comes into your mind. So those who want PhD, they have passion in the subject, okay? So your aim is to create new knowledge in the field. You will be trained to provide novel solutions to world's problem. And you are supposed to do an independent research. And what is driving it is our employability. The thing that is driving you is passion. If you think that you can be better employed here, I think you you may want to think about doing a master's instead, because here is where it's going to be a difficult path. You're not awarded for mastery of any field. You are awarded for scholarly achievement. Okay, so these are the different things, and maybe now you can realign and say, maybe I should be doing what I like to do. Okay, so these are the different pathways. So, majority of you chose masters. There are so many masters around. Okay, there are masters by coursework only, there are masters by research only, and there are masters where research and coursework. Which one do you choose? Okay, so I'm just going to walk you through what are the different study options. Let's start with masters by research only. In masters by research only, the advantage is that you will have extensive hands-on research in the field. Okay, there is also a potential for you to continue to PhD. So your aim is basically to do research. The disadvantage is because usually you dive straight into to research. You may not, your knowledge of this field may be only narrowly focused on the particular research project, and there'll be variable opportunities depending on the lab you are or the department that you are in. You have less opportunities to network with people or in the field. If you go for conferences, yes, but sometimes masters may be too short for you to go for conferences. So usually for PhD, they will have time for them to go conferences and meet with other people. So if you, so these are suitable for people who are interested to continue to be researchers or to continue to go to a PhD path. First of all, they are unsure whether this path is better for them or not. Then we have what we call the coursework only path. In this coursework only path, the advantage is that you gain in-depth knowledge of the field, and you will be able to network with your like-minded colleagues in your class, with faculty, as well as industry experts, because industry experts will often be invited to speak. Because remember, master's is mainly for employability, okay? But the disadvantage is you don't have hands-on experience, only maybe in the class a little bit, but not so much. Okay, so these are suitable for what? Who are they suitable for? If you already have a job and you just need this in-depth knowledge in this field, for example, you're a healthcare worker or you're doctors or you're policy makers like CEOs, you are government agents, you want to learn more about precision medicine. Or you're aiming for careers that don't require extensive hands-on, but they require your in-depth knowledge of the field. For example, you want to be a scientific writer, editors, educators, sales, marketing. So these, then coursework alone may be a very good path for you. Okay, so then we have this coursework with Capstone. So in coursework with Capstone, it actually have the advantages of both coursework alone as well as research alone. And if you were to choose in the industry Capstone, if you perform well in your internship, there is a potential for you to be hired. If you choose an academic path, there's also potential to be hired as a researcher, or you can go into PhD, because now you have both research experience too. Okay, so the disadvantage of this is that usually it is a longer training period, 2 years instead of 1 year, because you need to do the internship or the research. And it is suitable for those, it is good for everything, whether you're here or you're here. So researchers, bioinformaticians, and data analysts. Okay, so I think I'm going to stop here because I think majority of you are interested in masters. You may want to consider which type of masters may be more suitable for you. Okay, so I think it's here. I think that there's questions later on, so let me invite Dr. Lim to share with you about precision medicine.
Thank you, Prof. Lee. So as presented earlier, the healthcare landscape is continuously evolving, and education plays an important role to stay ahead of all these changes. So in this talk, I'll focus on how precision medicine training can facilitate a future-ready career in this data-driven healthcare economy. So before I talk about the training, just want to briefly introduce the basic principle of precision medicine. So what is precision medicine? So in the traditional approach or current practice, almost all of us will be given the same medicine. It's called the one-size-fits-all, but some might respond to the medicine, but some might not. And some can even develop a very bad side effects. That's because we all have a different DNA. And in precision medicine approach, we are trying to predict which group of patients are more likely to respond to the medicine and which group are less likely, and which group of patients will develop bad side effect and we don't give them the drug at the very beginning. So this can be done by analyzing the DNA, or we call the omics data, such as genomics, proteomics, metabolomics, or transcriptomics, as well as clinical, environment, and lifestyle data. So the goal is really to target the right treatment to the right patient at the right time. As you can see, the big data lies at the heart of precision medicine. Therefore, it's important to know how to collect, analyze, and integrate this big data. And with the abundance of healthcare data, there will be challenges such as data privacy and security concerns. So how do we store the individual or patient data properly? Or which computational tools or algorithms that are suitable to handle such big data? Nonetheless, challenges also present opportunities in innovation and also collaboration with different fields to develop new tools and technologies. So driven by the technological advancement and scientific discoveries, precision medicine field is continuously advancing. Therefore, it's important to have a precision medicine training to stay up to date with the latest trend. So it enables us to embrace the advancement and complexity, so we know which latest tool can be used in healthcare. And then it also helps us to develop key skills and knowledge that's required in this data-driven healthcare. So for example, we can use machine learning to analyze DNA data, and then we can make an informed decision. And then most importantly, it also opened doors for exciting career opportunities. So it allowed professionals to make a difference in patient lives by applying the precision medicine approach. So to succeed in this future-ready career in precision medicine, some of the skills and knowledge are required. So for example, this fundamentals of precision medicine, proficiency in omics, so we need to understand what are omics data. And then we also need to learn data analysis techniques, as well as what are the tools that can help us to get insight from this big data. And of course, precision medicine is not solely centered around the technical expertise. We also need to understand the ethical and legal consideration when we handle the patient or individual data. And also important to understand the economic implication when we implement the precision medicine approach in current healthcare. And last but not least, we also, after we learn the fundamentals, we also need to have the ability to apply the concepts into clinical practice. And if not, we can help to develop new tools and technology to solve the current problems. So we consulted industry experts as well as academia and medical leaders. We identified some of these key elements in precision medicine. So for example, under fundamentals, we have AI, high performance computing, statistics, the omics part, as well as ethics, regulation, economics, and some other precision medicine related application. So to help students to develop their expertise in precision medicine, we use this key element and design a diverse curriculum in this master's in science, precision health and medicine. So some of the fundamentals part will be taught in the core courses, or what we call the compulsory course. And then application part will be taught in the elective course, so you can choose which course that you're interested in. So for more information, you can scan the QR code here, or visit the website bit.ly/MSc-PHM0626. So the master program will be starting in January next year. So with the solid foundation in precision medicine, after graduation, there are several potential career pathways for the students. So for example, if you like to analyze data, like analyze big data, after learning the AI or high performance computing, you can take the data analysis and informatics roles to find meaningful insights and develop predictive models. And if you have the passion for research, you can take the R&D roles to understand the diseases and develop novel intervention. Or if you are someone who are very innovative, you like innovation, you can join industry and entrepreneurial ventures to develop innovative techs and solutions. And then if you are already a healthcare professional, for example, you are a medical doctor or nurses, if you're already in a clinical position, you can use the precision medicine knowledge to guide patient care decision or become the leader in this field. So the conclusion from our talk today is the healthcare landscape is evolving. So it's important to have the growth mindset to respond to these changes. And then learning precision medicine is also important for the future health-related career. And we encourage everyone to explore educational opportunities and stay updated with the industry trends. And this is our last question of the day. So if you were to pursue a graduate course in precision medicine, which aspect would interest you the most? Let's see if everyone is still awake after more than half an hour talk. Yeah, only one is awake. Yeah, okay. Yeah, so most of them are interested in some are interested in regulation. Yeah, we have one course about regulation, ethics, and economics. So there are others also. So out of curiosity, we just want to know what are the others in the next. So I'll click to the next slides. Oh, okay. Yeah, that's all from us today. Yeah. So for more information, you can visit the webpage here if you missed it just earlier. And then you can also join our online information section on Tuesday, 22nd August. So you can register here by scanning the QR code. Yeah, we will stay here for the Q&A section. Thank you, everyone.
Okay, thank you, Dr. Lee, as well as Prof. Lee and Dr. Ban for offering your time and expertise for the past 45 minutes or so. So with precision medicine being discussed so prominently, right, we'll expect a fair share of questions from the audience. So likewise, before we go to the questions that were submitted online, any first questions from the floor, the physical audience in attendance here today? Anyone, anything, just make the short walk to the mic and then let us know what you think. Nope. Then let's take a look at the questions that were submitted online during the course of the presentation earlier. All right, first question of the day, and I believe a good question to kickstart the session, very relevant one. So basically, do I need to have a medical-related background in order to be accepted in this MSc program, I suppose? Yeah.
No. So for this program, we are taking people with STEM M. That means any science, technology, math, engineering, or medicine. Okay, so in any of these fields, you're welcome to apply for this course. Although, we do not expect you to be good in both. So if you're kind of weak in one, we would kind of strongly encourage you. For example, you're weak in biology, we'll encourage you to at least read something about genomics before you come, or take a short course on genomics before you come. Those who are weak in computational, we may ask you to just take very basic R, Unix, or Python before you come. Yeah.
Great, thank you, Prof. Lee. That explains a lot. So next question, shall we? Okay, this is a full-time program, so will the workload be suitable for working professionals, and are there any future plans to offer it on a part-time basis?
Okay.
Yes.
Yeah, this is actually a full-time program because we believe that it is being immersed in the environment that will help you to move it fast. We understand that many of you are working professionals. We have developed what we call a stackable pathway. That is, instead of doing the full MSc, what you can do is you can choose some of these courses and take it as a module. That means take it as an executive certificate, which now can be stacked into a graduate certificate. If you take 2 relevant modules, you can stack it to graduate certificate. And if you do perform really reasonably well, you can use that to as credit for your master's program. So then your master's can be shorter. So you may have to, what I can imagine is perhaps you may have to take a few days break, a few weeks break from work to attend some a module. Some of the modules are condensed into 1 or 2 weeks. So you can just take 2 weeks break. Other modules, you may have to just take your morning off or your afternoon off on certain days. So you can choose this path. At the moment, we have no real plans for a part-time evening. There are modules that are held on Saturdays, by the way. So there will be modules that are held on Saturdays. There will be some modules that are held in the evenings, depending on the availability of the professors as well as the room. Yeah.
Thank you for sharing, Prof. Lee. I think that explains a lot in terms of the structure of this program. So before we move along, right, I'd just like to remind the physical audience, if you have any questions anytime, please raise your hand and we'll pause for you to get to the mic and ask the question. So please, sir.
Professor Lim, Dr. Lim, and Mr. Ken, thanks for the wonderful presentation. You mentioned genome sequencing was, rapidly evolving, and there's this ambitious goal for the 2027 to get it all sequenced for the population. Is there anything else in the horizon post of that initiative? If we move into this field, come 2027, is that done, and then what do they do?
Oh, no, as you see that it's constantly evolving. You'll see the cheese will be always moving. So you can see that although the plan relies on just say like DNA sequencing, it's not clear in the roadmap, but discussions at government level that will include things like sequencing our microbiome. So understand that actually we do have bacteria living within us that can impact our healthcare. And then they'll include proteomic stuff like this, and they're integrated together with clinical data as well as our wearables also. So the hope is that it will help to fulfill the Healthier SG kind of initiative, where we as consumers of healthcare like this may be more empowered. That means there's more data available to you. Sometimes it's too much, but hopefully with AI and machine learning, it can be presented in a way that forces you to take responsibility for your healthcare. So I think beyond that, there is some other roadmap, but the leaders at the national level maybe have not released that. But we can see that this is probably going to constantly evolve.
Okay, thank you.
Maybe I'd just like to also add that by 2027, only 100,000 of us, is it? Yeah. Only 100,000 of us, and there are at least 5 million of us. So, and those actually just serve as a control, and there we will still have to be sequencing the genomes of sick individuals and all this. Those are the normal.
Yeah, so that's why we noticed that in our course we do have an economics component. So we do not want healthcare technology to increase our, nobody wants a bigger tax bill and stuff like that. So these are all looked at the ministry level to see whether it makes economic sense or not. So we are constantly evolving. So in one possible future is that anybody who comes with a disease or even preventive health, you may have seen this already, it's offered in some clinics, even by some insurance companies where you can give your DNA and then they'll give you some sort of profile about some possible risk that you can take action, for example, to change your lifestyle or diet. So it's more information to you rather than looking at us externally. We do not know whether externally we look fit, but internally we may have some health predispositions. Yeah.
Okay, thank you.
Thank you, Prof. Lee. Thank you, Dr. Ban. So I hope that answered the questions for you. If you have any follow-up questions, feel free anytime. So any further questions from the physical audience before we get to the next one that is submitted online? Okay, then let's have a look at the next question that was submitted online earlier. Okay, since precision medicine can be a relatively new industry, how does your course curriculum stay relevant in today's situation? Because the world is moving so fast. So, interesting question, Prof, please.
It's a difficult question. Yes, we are trying to stay relevant by inviting industry experts to be part of the course too. And importantly, we have a module that is called a seminar series where every time all the students will have to attend at least 3 per semester, where the latest things about precision medicine will be, leaders will be invited to give talks. And we will definitely attune our curriculum with that, because he is at the national level and he knows most of the things at the national level.
So I also want to make a shout out. I mean, this is NUS. Our faculty are among the best, including also in precision medicine. So we do have faculty that are the cutting edge of research like that. The benefit of it is that we have a network here. Some of them actually are course instructors. Now, some of these research things may not actually translate, to the clinic, but we do have our ears to the ground about what is upcoming like that. So every time, as we have. Hopefully we sniff out the cheese, all right? And that includes feedback from students also, and also from our stakeholders. The curriculum cannot stay static, you know this. So we are also constantly evolve. So for example, if some courses, some things that, this particular field is, turns out to be no longer very practical, then the course structure will change like that. So we will just have to evolve with the times. Yeah, thanks.
All right, thank you, Dr. Ban. Thank you, Prof. Lee, for the reassuring answer. So yeah, next question. Okay, interesting one as well, because what are the potential employers in Singapore where the graduates from the master's program will most likely land a job? Yeah.
Yeah,
Dr. Lee?
so before we start this new master's program, we actually survey and interview several companies, and they are also think that there's a lack of trained personnel. So, for example, some of the pharmaceutical companies like Merck and Illumina and all that. So we actually interview them, and they are interested to hire graduates who has the precision medicine skills and knowledge. Yeah.
Thank you, Dr. Lee.
Yeah,
Certainly.
so basically, we did our homework, and there are companies that are very interested to hire people with precision medicine.
So I'd like to add also, because some of these companies actually have international arms also. So they're actually for internships, they're willing, for example, to explore students having internships also elsewhere. So we'll fit into a bigger network because we're just part of the global, we're just part of a global citizenship. And the benefit of this is that we're not alone in this. So there's UK, all the big markets are there. All right. So if you are willing to move outside Singapore, I think the world's an oyster in that sense like that. Okay, thanks.
Yep, so no shortage of options and employment opportunities, as you can see there. So next question, shall we? Okay, if I want to take up some short courses which might be related to PHM before applying to the MSc program, what are the short courses or professional certificates that would be best recommended? Any from the...
So it depends on your current background and experience. So if you are coming from like a computing background, you don't have the biology or you don't know what is omics, you can take some courses on genomics, proteomics, or you can read the books online. And then if you are more like life science students or coming from a biology background, you can take some programming courses like R programming, Python programming, or Unix online. Yeah, so these are some of the courses that you might want to consider because ours is a multidisciplinary program. Yeah.
So sorry, we didn't have time to show that one, but if you have the link down there, feel free to go to the website. There are combinations that you can take depending on what gap you think you've identified for yourself and you want to fill up. All right, so I think we didn't have time to show all that one, but feel free, the links down there. If you don't have it, I'm sure the organizers can talk to us.
You can come to our information session.
Yes. Yeah, we do have name cards also with all the information down there. All right, so shout out to our support staff sitting behind down there. So please approach them, Benedict and Suchita. Thank you.
Yes, certainly, or you can just approach any of our speakers right after this session. You can do it
we'll be
here,
here.
yeah, or can do it in room 331, just right down the walkway where you can have some food and beverages along with your consultation. All right, next question. Okay, will students in this program cooperate with NUH, the National University Hospital?
Yeah, so actually medical school is just next to NUHS. We are almost like we are part of this NUHS family. In fact, some of the instructors actually come from NUHS, not just that, from other clusters also. We cooperate with the other clusters, for example, in SingHealth also. So yes, so for example, you can expose in two ways. One, through the coursework where some of the instructors are actually from NUHS as well as some of the other healthcare clusters. The other thing is that in terms of the capstone project, that's where we have an option, for example, where some people prefer industry. So they choose a capstone project with industrial attachment, but some prefer more clinical labs, and then we'll try and identify. So that's our challenge as these program coordinators here to try and do the matchmaking to fit your aspirations. So that also could be, for example, NUHS does have, for example, a molecular diagnostics lab. They do a lot of these targeted resequencing for real patients like this. And we have spoken to the director, actually said is hungry for anybody who's suitably trained to join the team. So that's one, just to bring up one example of a close cooperation with NUHS. Thanks.
Thank you, Dr. Ban. So let's have the next question.
That's a good question. Sorry, we can't give you the thing right now because it's an inaugural thing. But maybe since we have this audience, I would like to announce that PRECISE, the one that the national body that is sequencing our genome, has kindly given us funding for scholarships for Singaporeans and Singapore permanent residents. So you are welcome to apply for these scholarships. So the acceptance rate, we're not sure. Yeah.
Thank you, Prof. Lee. So shall we flash up the next question? Okay, how is pathology relevant to precision medicine?
Okay, so pathology is very relevant in a few ways. Firstly, if you understand the healthcare system, any tissue that's taken goes through pathology. So you cannot sequence without going through them, all right? So pathology is relevant, firstly, because we take samples from patients to pathology because we don't understand the diagnosis, all right? Sometimes just by normal pathology workflows, we can identify it. Sometimes it's difficult, you need to combine it with omics. So for example, some tissue section are sent to the pathology lab. The other half is sent for sequencing and other things. So it could be the DNA, it could be the RNA, or it could be the protein. And that combination will help. The other thing also is precision medicine is not just about omics. Increasingly, people are looking into the imaging part of it. So you have heard of startups where the pathologist that looks at the microscope, looking at the cellular structures, people have developed machine learning algorithms to actually try and aid the pathologist to identify abnormal regions like that. So it's kind of an evolving field, although we say omics also, but actually anything that involves big data, including imaging and clinical data and lab tests. So all of these things will combine together to hopefully give a better picture of any health or disease state. Yeah.
Thank you, Dr. Ban. So I think we have crossed 4 p.m., so perhaps let's have one last question before we wrap things up. But of course, that's not the last that you hear from the speakers. You can always approach them after this session. So, all right, here's the last question.
Is there any forms of funding support? Yes. We have scholarship tuition fee waiver or tuition fee subsidy. Right now, we have got funding from the PRECISE, so it's mainly for Singaporeans and Singapore permanent residents. For the others, we're trying to still get funding. Right now, we don't have very much funding for it. Yeah. And also, if you are a doctor, you can apply for the NMRC. We have just got approval from NMRC, the training program.
Yeah, so this is an NMRC fellowship. So for doctors who want to upskill themselves, there's a list of approved master's courses. So we got a master's course that just recently approved. So a doctor, a healthcare professional applying to this one will be fully supported of a master's, including salary support. It's quite competitive, so, but it's limited to NMRC. So although it's doctors, but actually they do accept like healthcare professionals on a case-by-case basis. All right, so anybody interested, just go to, let's Google NMRC Fellowship. So as Prof. Lee mentioned, we're actively looking for funding sources like that because we know that master's program is actually a commitment, all right? It's not like, sometimes for those that are already working at that, there's an activation energy barrier. Okay, you're comfortable in your career, and to actually take some time off and spend money to explore a different career is something that we understand is quite difficult. But because it's a new program, we're in the early stages. As I said before, we are very happy we can partner with a national body to at least get that scholarship funding. All right, so we are continuing to explore. Again, we are sniffing out the cheese. All right. Anybody knows any sources of cheese? Let us know also.
Okay, with that last defining question, yeah, thank you, Prof. Lee, Dr. Ban, and Dr. Lee once again for both the presentation and the Q&A segment.